Congressman Sestak.
How are you?
Good. How are you doing? This is Ben Reichley with On the Mark with the co-hosts Mark Lawrence and Than Mitchell. Congratulations on coming to Central Pennsylvania.
Well, thanks. I'm really glad to be on the show. And again, actually.
We do appreciate that. Of course, the most timely thing on your agenda these days is a vote for and then words afterward about the health care bill that's moving through the House, and you voted for that. The public option is one thing that you've been talking about. Can you sort of reiterate some of your main points that you really started talking about nationally yesterday?
Absolutely. There are two major portions of this bill. Number one, we are going to remove from the insurance companies their rationing of health care. Presently, if you have a pre-existing condition, insurance companies deny you health care. Second, if you are a person who all of a sudden gets an illness, they immediately put an audit team on the paperwork in a process called rescission to see if somehow you filled out the paperwork wrong and can be denied health care. I know that because we keep my constituency office open 7 days a week, and we've had numerous people come in, and we've had to intercede to help them on this. So the rationing is going to be removed. Number two, and this is the public option and the value of it, what we're going to do is recognize that in 94% of all health insurance markets in America, the Department of Justice's criteria for non-competitive pricing is present. In Pennsylvania, two insurance companies have 70% of all the private health care plans. And so they can dictate as almost a monopoly what the prices will be. That's why 14,000 Americans lose their health care every day. Costs are being dictated to. So what we say is we have 40 million Americans who are uninsured. They are now going to be covered. But instead of just giving them to the insurance companies, we're going to put out there one more player. It's a choice. It's a consumer's choice. It's going to live or die on the premiums and copays and deductibles of those who elect to join it. But this public option won't be paying CEOs $23 million or $70 million severance pays, nor will they have high advertising costs or trying to make undue profits. And all of a sudden, you have a fair competition out there, and the price of premiums that have skyrocketed in 8 years in Pennsylvania 100% will start to slow down. That's why I'm an advocate for the public option, because if you have health care today and you want to hold on to it, you stay in your private health care plan. But we want to slow the rise of cost by having a competitor out there so that that person that you're with, that company, will slow down the rise of your premium so that company won't lose you.
Congressman, one quick question. You said there's 40 million Americans with health care insurance. Is that 40 million people in America without health care insurance? Not all are Americans, are they?
Good question. The reason I use 40 million is most people say there's 48 million uninsured in America. About 8 million of those 48 millions are here illegally. So I don't use that term. I say 40 million Americans don't have health care plans. And by the way, the bill forbids anyone who's here illegally from being covered by this plan. So no, it's 40 million Americans. Now, I think you bring up a great question. A lot of those could afford it, about 10 million. They're usually the masters of the universe, 30 years old. They're going to live forever, they think. They're making plenty of money. They'd rather have a night in the town on Philadelphia or something if they live in Philly instead of covering health care. But it's like car insurance. All of a sudden they're in an accident or they get deeply sick. They go to an emergency room. And you and I, on our private health care plans today, pay $400 extra to cover the uninsured because the emergency room passes the cost off to the insurance companies when they negotiate rates for you and me. And so what we're saying, like car insurance, everybody is going to be covered so we don't pay that, indirectly.
Well, Congressman, like car insurance, I pick my own car insurance and choose to pick the car I drive and insure it at certain levels. In a healthcare situation, I don't have a choice sort of to pick if I'm going to be in a government situation. And however, how does a private sector industry compete with the government?
Well, first off, remember, we're setting up first of all, if you're an employer, like you might have an employer providing it to you already, it's mandated that employer has to keep providing that health care plan. So for 80% of all Americans, 85% of all Americans, this isn't going to change anything for them. They're going to stay in their health care plans because that's their choice, and the employer has to provide it. For those 40 million Americans who are uninsured, they get a choice. They can go on the public option, but they don't have to. There's going to be a health insurance market, and Cigna, Highmark, Blue Cross Blue Shield will all put in their own private plan for these 40 million Americans to pick from. They get to choose, just like you can with a car, which insurance company they want to be with. They could be with a public health care plan, or they could be with the other ones. Third is, right now, and you bring up a very good point, is how do we want to make it so that these monopolistic types of insurance companies, I mean, truly, in the Philadelphia region, which 42% of all Pennsylvanians live within the media market, one company has 70% of all health care plans, and that company can dictate prices. Well, how do you make it fair? But also fair so that insurance company can compete in the future. So what we said is, this public option, we're not going to pay $23 million, as I said, to CEO. It's going to have low administrative costs, which makes this monopoly not tried to give $23 million to its CEO to be more fair on the premiums, not make undue profits. But we forced the public option to, when it negotiates with a hospital for the let's say 1 million people join up in it, when it negotiates with a hospital to be the provider, with the providers to take care of those who are covered in the public option, it must do so on market rates. It must negotiate good prices on market rates. So it's going to survive or not survive upon how well it does in the marketplace. But the difference is low administrative cost, because we're not going to have high advertising, undue profits, etc. What it does is it begins to break down the monopolies that are out there, but yet make sure it competes on the marketplace when it negotiates with doctors to come and take care of those who join up in it. And remember, it's a choice to be in the public option, not a mandate.
Congressman Sestak, this is Stan Mitchell across the table from these guys.
Hi, Stan.
And I happen to be one of those guys who kind of believes in a single payer, but there's an awful lot of conversation. This morning I checked Steve Chapman's column, and he said that a typical state has 27 insurance companies competing in the small group health insurance market, and that health care plans average profits of 3.3%. Is he right about that, or I've heard a lot higher numbers?
Absolutely. I heard this number for the first time late yesterday, 3.5% on the smaller side. But when you look at the large group markets and you look at the individual market, let's take women. More women work part-time than full-time because they usually are the ones that meet the kids when they come home, etc. And they cannot get employer-based health care. So they go on the individualized market, not the small group one, and in there the costs are truly exorbitant, and the majority of them deny maternity services. So when you look at the profit in there, that kind of counterbalances some of the 3.5% you might see in the small group. So, I mean, 3% is a pretty decent, good, that's not an outrageous profit by any means, you know. But when you look at the whole picture, big group, small group, and individualized market, what this does is begin to level the playing field in all that area. Look, the bottom line is this, that we know in Pennsylvania our premiums have gone up 100%. We know we lose 700 Pennsylvanians every day lose their private health care plan because they can't afford it. We know the number one leader of bankruptcy, even today in this recession, is medical cost. And so we have to do something. I believe the public option, Stan, and I understand the arguments for single payer, but I believe this public option still gives us the ability for competition, which I believe spurs entrepreneurship, but it also makes it fair competition, so with a mandate that everyone's covered. And every plan by 2017 will provide, because it's mandated, the same benefits Congress members get in their health care plan.
Boiling down part of what Steve Chapman said, Medicare has a higher administrative cost than private firms. Could you address that?
Medicare has a lower one.
Oh, okay.
Medicare's administrative cost is lower.
Okay, so you would say that Chapman was mistaken in his assessment?
Yes, sir. Medicare cost actually has lower administrative costs than private health care plans. Private usually averages about 17% higher administrative cost. Medicare, now there's different studies, some say 3%. I think the real number is about 8 or 9%. But it is less.
Okay. Thank you very much. Mark?
Yes, and that's the argument, though, single payers want to have Medicare cover everybody, is what they say, lower administrative cost. And I understand that argument, but I was in the military, as you know, for 31 years, and I was in charge of the Navy's $70 billion program, and although it's a good argument, and I don't dismiss it out of hand, I did watch our federal government have a hard time disciplining cost. As we procured a ship called DDG 1000, it was supposed to cost $1 billion. It ended up costing $5 billion because we didn't have the competition among the shipyards to discipline cost. And remember, we subsidize the single-payer systems in England and in Canada. They buy our pharmaceutical drugs for one-third the cost of what we pay for, according to the Government Accounting Office. And yet we are forbidden to re-import those same drugs that our pharmaceuticals sell overseas for one-third the cost, that kind of subsidize their single-payer system into back here. So there's a lot of mischief that we can make it more fair for us here. And I believe that what we've gotten through here will let you, if you have a private health care plan, keep it at lower cost, and we will get everyone covered, which means we won't be losing the $260 billion in lost economic productivity we lose every year because of the under and uninsured, because they're off the job sick more often. This is good for the economy. It's not only right to do, it's good for the economy. And small businesses will no longer have to pay 18% more for their small private health care plans as they do compared to big corporations, because they'll be able to spread the risk much easier.
Joe, I'm interested in the health insurance reform bill, examining it and just trying to see whether it would help or not. But I'll tell you what I'm afraid of, and that's that it's just simply the government's involved. And you think of what could possibly hurt this. Well, everything that the government does on a massive scale is synonymous with government fraud, government waste, racking up budget deficits. It just seems like this is just too much, that and the government will have almost no way to control it.
I wanted to answer that in two ways. I think what you say has become what has been most damaging to America, that the government has performed so poorly over the past X number of years that Americans have rightfully lost faith in the credibility of public officials and also therefore the public institutions to do accountable leadership, where they are accountable for not just instituting programs, but making sure they work well without the fraud. I mean, you probably heard of the latest leak that there's a lot of Congress members now that are supposedly under lobbying influence and all. I understand exactly what you're saying. And actually, that's frankly why I'm running for the U.S. Senate. 31 years in the military, principle should be the number one issue, not political calculation or your own job. So I take that on board. But number two, I also, and you know I got into this, I left after, I retired after being a 3-star admiral because my 4-year-old daughter had brain cancer, the same as Senator Kennedy. And I swore that after TRICARE gave her an opportunity to live, that I would work hard for everyone to have an equal opportunity. Plus, I knew economically, because my doctorate's in political economy, that health care costs were going to wreck our economy eventually. So I've worked hard on this bill, and what I can tell you is doing nothing is not an option, because cost of health care will be 1/3 of our GDP in another 30 years if we do nothing. And 14,000 people lose their health care plan every day, equivalent of Bethlehem in 1 week, or Allentown the next week, or Reading the next week. So my pledge, and I know I'm only one down here, but I hope to be a more significant one after the next election, is that I will watch this public option so it isn't one where once more the government tries to fix a problem but makes it worse. I do believe, therefore, that's why I'm supportive of not throwing away the whole system, just making private health care plans compete more fairly. And if you've got your plan and you want to stay in it, you get to stay in it. In fact, we're mandating that employers can't drop their health care plan, or they're fined 8% of their payroll. And so that keeps them providing it.
All right, we're going to have to stop you there. We're just about out of time. Ben has one. That's okay. Ben has one more quick question, and
know that.
We'll let him go ahead.
Congressman, can you give us just a snapshot of your campaign for the Democratic Senate against Senator Specter right now? Can you give us a snapshot of where you're at to date?
Absolutely. First, I am running against someone that I went out to Washington and I totally disagreed with, because Arlen Specter gave 2,000 votes to George Bush. He voted for the economic and tax policies that drove us into this recession, where the tax cuts, 53% of them went to the very wealthy. He did vote for the largest education cut in the history of America. I disagree with it. However, I don't think he's a bad guy. I just disagree. The future is one that needs new ideas and new energies, like we're talking about here, where he derailed the Clinton health care plan of the 90s. I fought hard for this health care plan to take care of Pennsylvanians. Number two, it has shown over the past, since he has spent $2 million since 1 January on his reelection, and yet every poll has indicated that he is now has only 23% to 28% of Pennsylvanians believe he should be reelected. I think it's time to thank him for his service. I am somewhere between 5 and 12 points behind him, depending upon which poll, where 4 months ago I was 40 points behind. I believe this more than anything, however. It's about the future, to where you can have someone who will forthrightly say, here's where I stand on Afghanistan, here's where I stand on health care. And I tell you that I will listen to you, but I want you to know where I stand, and principle is more important than my job. I just think they want a different type of leadership, a generational change. And that, to me, is why you have seen such a dramatic shift. Pennsylvanians understand, as I was asked the question, that Washington, D.C. has let them down. And I didn't grow up there. In fact, I'm running against the Washington establishment, and I promise to work hard every day for Pennsylvanians.
So, Congressman, you would attend Senator Specter's retirement dinner if chosen?
I would host it.
Well, Congressman,
I intend to.
Congressman, we appreciate your time
here. He's not a bad guy. It's just that the future is so different. We need a titan fighting for Pennsylvanians, and particularly small business. My gosh.
Well, we have to stop you there, sir. We're up against, I hate to do this to you. You do have an open mic to come back, particularly once the campaign is underway next year, but we're up against some breaks here. So, but we thank you.
Thank you for having me.
Yeah, absolutely.